Hello, I'm Dr. Jerry Williams with Urgent Care 24/7, and I'm here to talk to you today about a Delta variant coronavirus, COVID-19 Delta variant update. And I just want to chat about what we're seeing in our nationwide urgent care centers and the feedback I'm being given from hospitalists who are taking care of inpatients as well. This Delta variant issue has really kind of come and bitten us or caught us off guard. And while we were warned about the potential of this virus mutating by the increased number of people who were actually infected with COVID-19, thus the more patients were infected, the more times the virus replicated or reproduced. Therefore, the more likely it is to mutate or to change or adapt. We had been hopeful that that wouldn't happen, and unfortunately, it has. The Delta variant, there's not a test for the Delta variant that's done in a rapid manner. This has come up a lot. I've had a lot of questions from patients say, "Well, how do you know that you're testing for Delta variant?" And the answer is clinically, in the clinics, we do not know that. We just know whether someone's COVID-19 positive or not, or negative. But certainly the major laboratories and the CDC are monitoring positives and are testing for this Delta variant. And certainly it's the most common thing we're seeing right now. Now, I'm also getting a lot of questions about from people who are against the vaccine, about the vaccine, and because I've made it pretty clear publicly that I favor being vaccinated for COVID-19. I'm personally vaccinated, as is my entire family. And I still maintain that that's a deeply personal choice. But that being said, I would encourage you to get vaccinated. And let me tell you why. The mRNA virus vaccine technology, the mRNA technology, is something that has been very exciting, that we've been watching for a long time. And this pandemic brought up a perfect opportunity for the mRNA vaccine to be utilized, and it has been very successful. When you look at the number of people that have been immunized, with the number of complications that are out there that could be related to the immunization, it's a very small number on a percentage basis. And I know that some people don't believe that, but that's the truth. The second truth is that right now, 97 to 99.5% of the hospitalizations in the United States right now that are related to COVID-19 are coming from patients who are not vaccinated. So the vaccine is overwhelmingly effective in keeping patients from getting severe COVID-19 infection and ending up in the hospital. Now, are we seeing COVID-19 vaccinated patients get COVID? Absolutely we are. It is happening. But I will tell you this, the patients who are getting COVID-19 and presumably the Delta variant, who are fully vaccinated, these patients that are fully vaccinated, they are not getting very sick as a rule. In fact, overwhelmingly, they're not getting very sick. So there is clearly an advantage for patients who are immunized against COVID-19 in that they are less likely to contract the Delta variant. However, they also, these patients that are immunized, if they do contract the virus, they are less likely to get very ill from it and end up hospitalized and or die. So That being said, I hope that if you're weighing the risk-benefit ratio, and hopefully if you're watching this video, you're doing some research and you're trying to figure out what you think is best for you. And again, very personal decision, and I completely respect your freedom of choice. But that being said, as a physician, as a clinician, and as someone who's cared for a lot of COVID-19 patients, I encourage you to read the information, look at the facts, and please consider getting immunized. Hey, this is Dr. Jerry Williams with Urgent Care 24/7. The COVID update is such a large video. It's actually 10 minutes long. We're going to break it into 2 parts. Be sure you watch both parts, because if you see one without the other, it's not going to make quite as much sense, but a lot of information to cover, all of it very important. So check out parts 1 and 2. We'll be releasing part 1 today and part 2 tomorrow. So be sure to watch both. Again, Dr. Jerry Williams, Urgent Care 24/7. Life is 24/7, and so are we.